State Representative Bob Morris recently authored a bill that would cut back the powers of Governor Holcomb, local mayors, county commissioners, health departments, and other government agencies to put certain COVID-19 mandates in place for private businesses. But in his proposed amendments this week, it would expand that to more than just businesses, and some fear if the bill becomes law, it could make the pandemic worse. A number of changes in the COVID-19 response statewide could be on the way if House Bill 1519 becomes law. Republican State Rep Bob Morris of Fort Wayne proposed amendments to the bill this week that he authored to say it shouldn't be a government's role to tell churches, private schools, hospitals, and private businesses how to safely operate, believing some operations are being hurt while others thrive.
Those people at these big box stores were shopping for flowers, plants, like any other nursery. And the local businesses, the local people running these nurseries were limited by a government action. And I don't feel that government should limit the occupancy of a restaurant or an establishment, that the business owner can make those decisions.
The bill proposes limiting state and local governments' powers to mandate masks in places of worship and private schools, limiting procedures at hospitals, and reducing capacity and business hours at businesses, among other items. The fear is rescinding these powers now could make the COVID-19 pandemic worse. Democratic State Rep Phil Giaquinta from Fort Wayne says he has sympathy for small businesses, but thinks government agencies are acting in the best interest of public health.
Nobody wants to see a business go out of business or have any difficulty in trying to continue to serve their customers and all that stuff. But to hamstring anybody from having the authority to do that is difficult. It's difficult and could be quite dangerous.
Morris says his bill is about the future.
What I'm doing here with these amendments is I'm looking forward to the future to look at how Indiana businesses will be affected if we have another pandemic.
But while in a pandemic, Giaquinta says relying on what the science says now is best.
I've seen several news conferences this summer and fall from Governor Holcomb who had said he relies on his healthcare experts and to be able to make these decisions. And I think that's what we should continue to do.
House Bill 1519 is still in its infancy, and it still has several readings and votes to go through before landing on the governor's desk. You can read the bill in this story on our website, WFFT.com. Reporting in studio, Caleb Saylor, Fox 55 News.